Hello and welcome to our presentation. We're happy to give you a short overview about motives and barriers to blood donation in deferred first-time donors as our contribution to this year's DoRN Symposium series. My name is Klara Greffin. I'm currently a PhD student at University of Greifswald, and today I'm also presenting on behalf of Julia from Pressentin-Panzer, who's currently writing her bachelor thesis under my supervision. So this presentation can count as a double early career work. So as you might know, we are currently facing challenging times in many Western countries due to an increasing demand for blood products, while the number of blood donations are decreasing. Demographic change is one important reason for the decrease in first-time donors, but further, increasingly strict donation criteria are applied, which lead to an additional decrease in donations. That being said, it is important to highlight that most deferrals are temporary deferrals, which means that people who are willing to donate blood can come back for another donation attempt. But still, we observe that temporary deferrals have a negative effect on return rates. However, we know that the negative impact of deferral on return rates is higher among first-time donors compared to recurrent donors. So this observation among the group of first-time donors leads us to our research question. We were interested in qualitative data about motives and barriers to blood donation and how they might change after an initial deferral. So we got the chance to include 4 items in a large representative survey of the German-speaking population, in which more than 2,500 participants were interviewed. Our items aim to assess past donation or non-donation behavior as well as future donation intention. Our first item was, have you ever donated blood? And one could indicate the response in 4 categories. No, I could not imagine to donate blood so far. No, although I could imagine to donate blood. No, but I've already made a blood donation attempt where I was deferred. And yes, I've already donated blood. This closed question was complemented by an open question with which we wanted to assess the personal motives and barriers for non-donation behavior in the past, or even donation behavior. So we asked, based on your answers, we would like you to describe in your own words what your personal reasons were for donating or not donating blood in the past. We asked the same 2 items about the future intention to donate blood, also complemented with an open question. So finally, we collected socio-demographic data of our participants and then analyzed our data using well-known software like IBM SPSS and Microsoft Excel. We calculated t-test, Mann-Whitney U-test, chi-square independence test, and also descriptive statistics, and the answers to our open questions were coded using an already published category scheme. So as you can see here in this diagram, there were 128 deferred first-time donors among the 2,500 participants of the study. So we learned from our data that 2/3 of the deferred first-time donors are women, and that we can divide our sample into 2 subsamples, with subgroup 1 a larger group of persons without future donation intention, and a smaller group, subgroup 2, including persons with future intention to donate blood. Comparing these 2 subgroups, we see that subgroup 1 is significantly older. Additionally, the share of women in both groups is higher than the share of men, but looking at the percentages of women in both groups, we see that there are more women in subgroup 2. With regard to the occupation, the share of full-time employees is higher in the second group, so in the group with future donation intention, while the group of pensioners in subgroup 1 is larger. No patterns are found between the 2 subgroups with regard to the other socio-demographic variables. So if we now look at the motives and barriers to past blood donation behavior, it is not surprising that most frequent barriers were named in the domain lack of eligibility, mostly health, which is probably the reason why a person experienced a deferral. Most frequent motives were named in the domain norms, with altruism being an important category. We now compare subgroup 1 to subgroup 2. We see that in subgroup 1, the group without future donation intention, most frequently stated motives and barriers were health, altruism, and other specific reasons which refer to the lack of eligibility. Whereas in subgroup 2, most frequently stated barriers and motives were altruism, health, and future-related reciprocity. We are now switching to the motives and barriers to future blood donation intention, and we see that lack of eligibility remains the most important domain. Within subgroup 1, so the group of people without a future blood donation intention, the most frequently stated motives and barriers were health, non-specific reasons, and age, all categories referring to the domain lack of eligibility, and a large proportion of respondents made no statement. Compared to subgroup 1, subgroup 2 most frequently stated motives and barriers like altruism, health, positive physical consequences, future-related reciprocity, a good course, supporting the health system, and an absence of disadvantages. So there's a gap between subgroup 1 and subgroup 2 with regard to motives and barriers. Looking at our data from another perspective, we can also observe changes in motives and barriers to past donation behavior and future donation intention. So within subgroup 1, for instance, the group without future donation intention, we see a decrease of statements in the domain lack of eligibility, for instance in the category health, and a strong decrease of motives in the domain norms. However, we also observe an increase in the number of categories in the domain barriers, for instance, organization, lack of time, and personal reasons, and an increase in the category no statement. Compared to subgroup 1, in subgroup 2, we've got participants with a future donation intention. And here we can observe a decrease of statements in the domain lack of eligibility and in the domain barriers. Also, we can see an increase in statements in the domain of norms, and in contrast to subgroup 1, more people stated altruism as a motive for future donation behavior. So let's enter a first discussion of our data. First, we saw that 2/3 of our sample were female, and more women than men were in both subgroups. This is in line with various studies showing that women get more frequently deferred than men, for instance due to low iron levels. We also saw a tendency towards a higher proportion of women in the group of people with the intention to donate blood. And this is in line with a study by Reed and Wood, in which proportionally more women were in the group of people with a high intention to donate blood than in the group with a low intention. It was also obvious to see that the group without future blood donation intention is significantly older. This is in line with a study by Sahil et al. That showed that people from older age groups are significantly less likely to report intention to donate blood within the next 6 months than people from younger age groups. What is also interesting to see is that altruism is an important motive for past donation behavior in both subgroups, and this can also be shown in other studies. However, there was a decrease of statements related to altruism in the subgroup without future donation intention, and it would be interesting to learn the reason why. So is this maybe caused by the deferral? Our sample consists of deferred first-time donors, which is why it is no surprise that the domain lack of eligibility is relevant in the sample due to the experienced deferral. The barrier health was frequently reported in both subgroups concerning past non- or donation behavior, but prospectively only in subgroup 1 without future donation intention, which is why we were wondering if this is perceived health status we are talking about or an actual deferral reason. We know from the literature that deferral reduces return rates, and that it is important to develop interventions specifically for this group of potential donors in order to increase motivation for future blood donations. We are now thinking about how we can integrate the aspects like health promotion, prevention, gender, and even health literacy in the context of blood donation. Without this short discussion, it is important to mention that this study isn't free from limitations. As such, we're currently facing some biases with regard to the retrospective interview with a cross-sectional design and further biases due to social desirability. In addition, it cannot be verified to what extent the intention to donate blood was actually put into practice. And last but not least, the comparability of the groups was very limited by strong differences in our group sizes. So where do we go from here? Julia and I are currently conducting a scoping review on literature addressing deferred first-time donors, and in the next step we would like to derive a gender-sensitive intervention for deferred first-time donors to buffer the impact of deferral on return rates. I'm about to hand in my PhD thesis, so afterwards I would really like to build a team and focus my research on deferred first-time donors. I will apply for research grants starting in June, and I would love visiting labs to exchange ideas and collaborate. Thank you very much for watching our video, and feel free to contact us in case you would like to exchange ideas or in case you've got some questions to our presentation. Thank you, DoRN Symposium series, for having us.